Hello, and thank you for joining today's session. My name is Liz Ashall-Payne, and I'm the Chief Exec at ORCHA. Today's session is about ambiguous advice, questionable quality, and how to determine and evaluate the quality of digital health apps. For those of you who don't know ORCHA, ORCHA has been working in this space for around about 5 years now. And our mission is to distribute digital health solutions to populations, patients and healthcare professionals. And in order to do that job, we've become highly expert in evaluating digital health, because in order to distribute them, the first question is know which products are good. So obviously I'm going to be talking to you about digital health and health apps. And before I talk to you about how you determine and evaluate the world of digital health, I wanted to start by setting the scene. And what I wanted to do was share with you some more information about the world of digital health and what that looks like. So at a very, very high level, we currently have access to, actually that number's different now, it's grown since I last updated these slides. So it's over 365,000 digital health solutions that are available. And that's over 365 apps just on the app stores, plus all the other digital health solutions that we're starting to see emerge, web-based solutions, native apps, etc. So we have a huge volume of solutions in this space, and that's one of the challenges. The next interesting thing is every day over 5 million people download an app, a health app indeed. And what that tells us is that our populations are ready to consume these solutions. And there's obviously a lot of data on this slide, but the one area that I'd really like to identify is that bottom right-hand corner stat, which says that over 90% of health and care professionals actually believe that apps could help their patients' health outcomes. So that gives you a very high level overview of what the world of digital health looks like. And then what is also interesting is we all now own smartphone devices. There are currently more smartphones on the planet than there are toilets and toothbrushes. So more people have access to a smartphone device and can therefore access this world of digital health. And if we drill in a little bit further, what's really interesting is seeing what the world of digital health looks like. And what we've seen over the last couple of years is a shift from the world of digital health being predominantly in fitness and in diet and in well-being to now actually moving more and more progressively into specific condition areas. So more development in the area of digital health for health conditions. So by way of example, this helps you see what digital health solutions there are in different domain areas. For example, 28% of digital health solutions focus on mental health. That's about 20,000 solutions. So we've got this huge opportunity, and basically if you can think of a condition, what we know is that there are a big number of digital health solutions available for that condition, but what we don't know is whether they are good or not. And that's one of the barriers as to why we've not picked up the opportunity that this landscape presents. So just to drill down a little bit further into some of those barriers. So why have we not taken up the opportunity of digital health and how digital health is presented? So there are 4 big blockers to us using digital health. And I've just touched on one, which I will come back to, which is trust. But actually before trust, the first biggest blocker is people actually aren't aware that these solutions even exist. So if you talk to somebody, maybe a friend or a colleague, and ask them, did you know that there are digital health solutions that can support people with mental health, depression, physical health conditions, long-term conditions, maternity, anything, awareness will be low. People don't even know that these solutions exist. And actually, as an NHS clinician by trade, I know that I wasn't trained in knowing what the landscape and the opportunity is within digital health, and so healthcare professional awareness can be limited too. The second big challenge is access. Once you become aware that these solutions exist, where do you go to find these solutions? And that access is at its most fundamental level. So you might say, well, I will go and find an app on the App Store. And I'd urge you to try that. Go to the Apple App Store or Google Play and type in a word like dementia, and you'll get very few results, if any, found, when in fact there are over 3,000 products available to support dementia. So accessing even a long list is a real challenge. The next challenge is the ultimate challenge. It's trust. And trust is not unfounded. And our research and work has shown that only 15% of all digital health solutions meet quality criteria that you would expect. And unfortunately, there are quite a lot of bad products on the marketplace which are available for download by end users. So, for example, suicide prevention products that actually tell you the fastest way to kill yourself because of really poor user design. Diabetes monitoring products that tell you that if you put your thumb on a screen, it can tell you what your blood sugar levels are. It doesn't work. Equally, blood pressure apps, they say the same. Put your thumb on the screen, it'll tell you what your blood pressure is. What's scary about those products is that they quite often give you a false negative, telling you that you're okay when you're potentially not. And that can lead to serious crisis, stroke, heart attack, or even death. So this trust is not unfounded, and it isn't something that can be taken lightly. And that's the ultimate blocker. The fourth big blocker is also ongoing risk management and governance. What's really interesting about digital health is it will update and change according to user feedback. And that's brilliant. However, if I recommend you as my patient a digital health solution, and then it changes in an unsafe way, how do I know? How do I manage that future risk? And that is a big blocker in enabling us as healthcare professionals or even as end users to use these products so that we know that we can have that ongoing trust. And so obviously you've heard me talk and really focus on that trust area, and that's really what today's session is all about. How can we actually trust these products? Well, that has to start with a review of the products. And what I'm going to do is talk you through in quite a high level way how ORCHA is working to review and approve more digital health solutions than anybody else in the world, and how we're working with government bodies to support them with this challenge. Now, the first thing that we do when we pick up a digital health solution is the first question you have when you start to think, well, where do you start with reviewing and accrediting the world of digital health? And the answer to that is really you have to start right at the beginning. And right at the beginning means starting with that full 365,000 digital health solution landscape. So how do you do that, and how do we do that? Well, what we've done is we've built a review accreditation engine which allows us to do a data scrape on a week-to-week basis on a global level and pull into our engine all the information about all the digital health solutions available to us. And what that system does initially is it just applies a very, very quick overview of, has this product been updated in the last week? Has it been updated in the last 18 months? And what language is it in? And what that basically then gives us is that overview information of how many digital health solutions are available, how many have been updated in the last week, and how many are out of date. If a product hasn't been updated in the last 18 months, it will be glitchy and data security will be compromised. So we actually say to those products, you've not met our pre-qualification question, and therefore you can't go through the review process. Now, what we do is we contact those developers to tell them that their product is, in our language, redundant, but if they update it the next week, it will get pulled through. And what's really interesting is that 2/3 of all digital health solutions fall into that category of not being able to have been updated in the last 18 months, so they're redundant. 2/3 of all digital health solutions are redundant. The next thing that we then do is we then classify the products into 350 clinical domain areas. And we use thousands of mesh terms to do that job. And we put the products in rank order from the highest downloaded backwards. And that in essence gives us a queue. And we review the next product in the next clinical domain area, because if people are using those products, then they need to know whether these products are safe. We also have other queues. So we work with government bodies like the NHS, but also ministries of health in 11 other countries across Europe, the Middle East and in New Zealand. And they have their own queues, and they ask us to process and review products on their behalf. So when we pick up a product to review, the first thing to work out is what kind of product is this, and not all apps are the same. So you can't assess them all in the same way. Some products are highly complex, medical devices, they push and pull data into clinical environments. Others are very simple, but don't take any data. They're more about well-being, so the clinical risk is reduced. And so the first thing that we do is we work out the risk profile of a product. And this slide gives you an example of some of those different types of products available to us. So for example, preventative products. This is the largest group of apps in the health and fitness and medical categories. An example would be an inhaler technique, stress management, fitness and diet apps. And these are pretty regulatory light. By comparison, all the other digital health solutions are pretty heavy from a regulatory perspective. So you've got clinical pathway support products, pathway replacement and administrative support, decision-making tools. So we work out what the risk profile is of a product, and that helps our review engine then pull together a bespoke review process for that product. And that's really quite important, so that we're only asking relevant questions of that product. What we then do is we then apply all of the relevant questions across these domain areas that you would expect. So data privacy, you will all have heard of GDPR, but there are other areas in data privacy around consent, authentication, interoperability, etc. The second area is data security. So what is the product doing? How is that product holding the data? And there are certain guidance and regulations that you may have heard of. It's overseen by the OWASP best practice guidelines. And this is about looking at accreditation regimes such as Cyber Essentials and ISO 27001. Those are the kind of regulations that we're applying there. The third area, and the heaviest from a regulatory perspective, is the clinical assurance, as you would expect. So this area is absolutely packed with regulations and standards and policy requirements, and this is quite often dependent on the country that you're working in. And areas that we're looking at here might be medical device regulations, CQC within a UK environment, clinical safety, clinical impact using the NICE evidence standard framework, etc. And this is the heaviest area around clinical assurance. And then the third area that you need to think about is the user experience. And this is extremely light actually from a regulatory perspective. So it's heavily weighted on access and usability standards. But we are starting to see new standards emerge in this area. So what does good user experience look like, and how can we assess that? And we're actually doing a project in this area with the Hartree Centre and Innovate UK. So hopefully we'll be able to support further differentiation in that user experience area. Now, once we've applied all these regulations to a product, we first and foremost go back to the innovator and help them understand where their product sits and provide them with information about how to potentially improve in any areas where they may have a gap. And that's really important, because for an innovator, this is extremely confusing, and it's an ever-moving, ever-changing landscape. So we work very closely with innovators to help them know what they need to do. And this is really important for getting to that accreditation layer. So the way in which I mentioned that we work with 11 countries, and the way in which we differentiate the review process is what I've just talked you through, is basically the ORCHA Foundation layer review, or ORCHA baseline review, which, as you can hear, is quite detailed. It's over 300-point assessment covering all those areas I've just mentioned. But then when we're working with a specific organisation, normally a national body, there may be additional questions or additional levels of scrutiny that government body wants to take a product through, which is very specific to their own requirements. And so what we add to that foundation layer are enhanced review components. And these are additional questions that we can take a product through, and once they've met those requirements, they can then be accredited by that accrediting body. So as I mentioned before, this is how we've been working with NHS Digital to get that level of accreditation, but also working with other ministries of health. And the beauty of this means that as an innovator, you only have to go through that baseline review once before, and then you only have to add on the enhanced review elements to achieve accreditations for different jurisdictions. So that's how we're coordinating and achieving real economies of scale with our work. And to give you an idea of that scale, we've currently reviewed 6,000 products, and that's a fully maintained review of that product. Every time that product updates and changes, we re-review it. And we add to that list about 500 to 600 new products every month. So it's an ever-growing ecosystem which everybody can benefit from. We're not actually just looking at those review areas I've described. We're also getting more information about the digital health solution, particularly around who this product is designed for, a little bit of developer due diligence, what the product works with, what are the functions and features of this product, what are the commercial models. And this is really important, because we're not just interested in reviewing products, we're also interested in distributing them. And at point of distribution, which I'll come on to a little bit later, we need to be able to support people, patients and healthcare professionals to be able to search and find the right product that they can trust for the person they're wanting to recommend or suggest this product for, or to use themselves. And therefore these other areas are also really important when you're looking at determining a product and its fit for a patient or for yourself. So we bring all of this together. As I talked about, on the left-hand side, we do that ORCHA collation, curation, filter and queue, pulling in weekly information from the app stores and selected websites. We then auto-categorize and provide data enrichment, and we provide that filter and queue. We then go through that review process, and then we promote that information through tailored app libraries and search engines, and I'll briefly show you what they look like in a second. And the critical part of this is that loop around at the top, the continuous surveillance and monitoring of this landscape, which comes back around the loop repeatedly. So that's really important for the app libraries that we then provide. And here's a selection of a few digital health libraries that we have. So we then use that repository of information to put that information into locally targeted, locally branded app libraries, which are promoted to specific populations so that they now have a trusted place to go to. And healthcare professionals can use these libraries not only as a library to search for and find solutions, but to also turn that library into a formulary, giving them more information about the solutions and enabling them to prescribe these solutions via text message to their patient's phone. And that's really important for that blocker I talked about around ongoing risk management. If I recommend you an app using this solution, the system knows which products have gone to whom and whether they downloaded it. And as it's being re-reviewed, if a future fault is found, we can do a recall should it be required. And that supports that final blocker of governance. And so answering the question of how do you evaluate, it is an ongoing evaluation, re-reviewing as the product updates and changes, re-reviewing as new regulations come to light. If anybody wants to learn more about our work, please do get in touch with us at hello@orcha.co.uk, and we'd be very happy to take your questions. Thank you so much.